Hello viewers, welcome to our Facebook live session. Today on this World Mental Health Day, we have with us our specialist, Dr. Sameer Gore, a psychiatrist at Apollo Hospitals, Navi Mumbai. He comes with over 23 years of experience in his field. Today we will be discussing about few questions regarding World Mental Health Day. Welcome to our live session, Doctor.
Thanks.
The first question is, so what does mental health mean?
Mental health means mental, emotional and spiritual well-being and not just the absence of disease. But then we come to the next question is, what is normality? Normality in mental health is undefined. However, abnormality is defined. Abnormality of the mind is determined by the following factors. If the behavior causes distress to self, then it is deemed to be abnormal. If it causes distress to others, it is deemed to be abnormal. A matter of degree and social context are equally important.
A lot of youngsters are being affected with mental issues like generalized anxiety disorders, depression, ADD and ADH, etc. Why is that and how can those be prevented?
Well, there are general reasons for mental illness in youngsters and adolescents. The commonest being genetic factors when there's a family history of mental illness, personality factors such as obsessive compulsive personality disorder, where the person sets very high standards for himself, he can't meet the standards and therefore is stressed, and stressful life events. The role of drugs and alcohol should also be stressed. The above can be prevented by leading a healthy lifestyle, analyzing stress and seeking early help from a mental health professional. Stress management comprises of exercise, pranayama, yoga, adequate and healthy diet, work-life balance, and modifying goals and expectations in life.
So doctor, along with the youth, many children also suffer from mental health disorder. How can parents recognize this and get children the help they need?
I can answer this question, madam, by giving certain examples like in ADHD, depression and anxiety. ADHD is an attention deficit hyperactivity disorder where the child has inattention, hyperactivity and impulsivity. One has to look from the input from the school and the report of the school teachers who report that he is academically backward. He interrupts other students, blurts out answers, does not sit at one place and does not perform well in his examination. Besides this, there may be certain behavioral issues with the child and the child can present in this manner. If the child is depressed, the child has sleep and appetite disturbances, he is withdrawn, uncommunicative, he has crying spells, and at times he has suicidal thoughts and self-harm behavior also. This can present as behavior problems, academic backwardness, self-harm and aggression. As regards anxiety, the child is always worried and cannot perform, so he may present with academic backwardness and behavior problems. Treatment is the combination of the input by child psychiatrists, child psychologists, teachers and social workers.
So doctor, a lot of people are scared of taking medications for mental health disorder. What could you like to tell them? Well,
medication depends on the type of mental illness and duration or characteristics of the mental illness. If we look at psychosis, psychosis is a major mental disorder characterized by delusions, hallucinations and absence of insight. If the patient has one episode of psychosis, then the medicines are to be taken for 6 months. If the patient has 2 episodes of psychosis, the medicines have to be taken for 2 to 5 years. And if the patient has 3 episodes of psychosis, the medicines are to be taken lifelong. However, this is not exactly the same case in depression. In the first episode of depression, the patient has to take medicines for the 6 months when he is absolutely asymptomatic and is 100% better. As I will reiterate again, medicines depend on diagnosis and duration of the illness. When medicines should be a part of a holistic therapy and not just only medicines but comprising of psychological input and counseling. Duration of taking the medicines should be discussed by the patient with the psychiatrist. The patient should be informed about the side effects of the medicines and their treatment. Most psychiatric medicines are non-addictive. Those causing addiction should be given for a short period of time in low doses with clear-cut goals in mind. Concerns about addiction of any medicine should be discussed by the patient with the psychiatrist.
So there is a lot of stigma attached to mental health issues. While these barriers are coming, we still have a long way to go. How can we break this pattern?
Well, this is a difficult, stigma is always a difficult thing to break, but we can do certain things by which it can be minimized or broken. Education about mental illness, propaganda about mental illness, early diagnosis and treatment, removal of myth and misconceptions, and the legislation as the current mental health law. Now, one more thing which can be done, we can move on to the biological hypothesis of illness, whereupon mental illness can be deemed to be because of neurotransmitter disturbances in the mind of serotonin, epinephrine, and dopamine. If one concentrates on this model and explains this model to the patient, it becomes a sort of a neurological model, and there's less stigma attached to this.
So what are the most telltale signs of common mental health disorders?
Well, mental health disorders can be divided into organic disorders and functional disorders. In organic disorders, there's a history of head injury, epilepsy, high-grade fever or loss of consciousness. There's disoriented in time, place and person and confusion, and also memory problems as in dementia. In functional mental disorders, they can be further divided into psychosis, depression, mania, anxiety, phobias, OCD, PTSD and eating disorders. In psychotic disorders, there is a dissociation from reality, whereas the patient is not aware of his reality. He is the victim of delusions and hallucinations. He feels people are talking about him, looking at him, following him, trying to harm him. People are inserting thoughts in his mind, withdrawing thoughts from his mind, and thoughts are being broadcasted, or his spouse is having an affair. All of which is untrue. In depression, the person presents as somebody who's sad, fatigued, feeling helpless, hopeless, worthless, withdrawn, uncommunicative, irritable, feels life is not worth living, is not able to enjoy life, which we call anhedonia. He also presents with self-harm or suicidal thoughts and also acts of self-harm, suicide and aggression. The next disorder I will come to is maniac depressive psychosis or bipolar disorder. Here the patient presents as somebody who's grandiose, feels he's got lot of money, lot of power, lot of political contacts, goes on a spending spree, starts giving away things, cracks jokes inappropriately to make other people laugh. Here also there is a dissociation from reality. The next disorder I will discuss is anxiety disorders, where the patient is anxious, tense and worried all the time. In panic disorder, he gets attacks of anxiety characterized by chest pain, tremor, respiration, choking, difficulty in breathing, and palpitations. The other disorders are phobia. A phobia is an irrational fear of an object, activity or situation. The next disorder I will come to is quite common, obsessive compulsive disorder. Here the patient gets obsessions or repeated thoughts in his mind, like counting, checking, cleaning and he performs those activities to get rid of the obsession. Then we come to PTSD or post-traumatic stress disorder. Here, the patient has experienced a significant life-threatening trauma in his past, due to which he recalls that trauma, he gets nightmares, flashbacks, re-experiences the events and has anxiety and depressive symptoms. The next disorder I come to is anorexia nervosa and bulimia, which are eating disorders, which present in adolescents and the incidence is more in females. Here the patient feels has got body image disturbances, so feels that he's overweight, she's overweight, needs to reduce weight, induce vomiting, make herself sick and abuse purgatives and laxatives. In bulimia or binge eating disorder, one consumes a very large amount of food in a very small time, and this is called binge eating. So this is an overview of the major organic and functional psychiatric disorders.
So doctor, depression is to be treated with medicine or a psychotherapy?
Ideally, depression should be treated by a combination of medicine and psychotherapy. Most commonly used is cognitive behavior therapy. A combination of both is more useful than individual modalities alone. Now, there are some cases where medication cannot be given. If the depression is mild, it can be treated by cognitive behavior therapy in this case.
So does depression affect my appetite and weight?
Yes. Depression can affect your appetite and weight in both ways. In the common depression which we see, there are appetite disturbances, that one does not feel hungry and therefore can lose weight because the intake is less. However, there's one more depression called atypical depression, where the appetite is increased and the food intake is increased, and here the weight may increase.
We come to the last question. What kind of lifestyle change will help to overcome my depression?
It would be, first of all, physical exercise after consulting your doctor. Physical exercise secretes endorphins in the brain, which have an antidepressant effect. One has to do effective stress management. There has to be a work-life balance. Yoga, pranayama, meditation should be practiced, and illicit drugs and alcohol should be avoided.
Thank you, Doctor, for joining this session. Dear viewers, if you have any questions related to this topic, please drop your questions in the comment box and we'll address it to Dr. Sameer Gore. Thank you.